Hello and happy Friday. There's been a growing interest in skin treatments for patients with skin of color, and so I thought I would go through a couple of different ones that we should both consider and be a little careful of, just because that skin you have to be a little bit more kind of thoughtful in what you do for planning. So the issue really is that the darker our skin, the more likely it is that it could come back with something called PIH, which is called post-inflammatory hyperpigmentation. And any form of inflammation can then cause that skin to come back with darker deposits of color around it. Now, typically those are going to resolve over time, but that's like a months-long process that we'd really like to avoid. So when we do things like cosmetically, of course, we have to keep that in consideration. So in that sense, what are some of the skin treatments then that we could do? Well, the first thing we want to do is we want to try to avoid heat, because heat is something that is going to induce more likely PIH. So when we talk about treatments, we can do things like microneedling, which don't generate any heat. Or as it turns out, there's a new addition to microneedling called radiofrequency microneedling, which also tends not to add a lot of extra heat. Now, just as a quick aside, we've tried that in our office and we were not very impressed by RF microneedling. But that is a treatment that should be, again, safe for skin of color. The other things you can do are things like light chemical peels. Again, typically not something that's a really full thickness type of defect or a deep type of skin treatment, but something that's in the lighter chem peel is definitely a possibility. And so are some of the specific lasers that are new. We have a new, well, it's not new now anymore, but we have something from Cyton called Moxie, which is a fabulous choice for patients with skin of color. You can do all kinds of injectables that really doesn't induce any problem, and the same is true with fillers. So there are 5 or 6 really quick, simple ideas. PRP, PRF, that's even another one that we can do that is actually safe within those patients with skin of color. Now, what should you avoid? Well, anything that is what we consider deeply ablative. Now, ablative really means we are actually ablating a layer of skin. We're taking off full layers of skin, as opposed to something that is partially or fractionated in its ablation process. Again, we use Cyton, that's called profractional. That is, again, thought to be much more safe. But anything that's fully ablative and especially deep, that would be an issue. Other lasers that generate heat, things like an alexandrite hair removal laser or a Q-switched laser for tattooing, those are all areas that leave behind a fair amount of heat and therefore would cause a high likelihood of PIH and probably should just simply be avoided. What do you do if it actually shows up, or how do we actually try to manage that? Well, we can actually pre-treat the skin to try to suppress some of the enzyme that's specifically generating this melanocyte activity. The melanocyte is that cell that generates the melanosome, and within that is the pigment component of what we get. If you think about what happens in tanning, that's also the normal tanning process. So we can basically inhibit some of that enzyme activity. And you can do that by pre-treating with things that are considered or often talked about as bleaching agents. Now, the fear, of course, is that a bleaching agent means that you're going to end up with some alabaster white or some blanched out color that doesn't look natural. That is not the case. It really does help to work and control the abnormal pigmentation. So again, bleaching creams are very commonly used. The most common one, the most powerful one, is called hydroquinone, and so we put HQ in a lot of different protocols in patients who are sensitive to that or don't necessarily want to be on that. So we actually do have to kind of pulse that from time to time. We want to get you off of that for windows of time as well. You can things like kojic acid, or you can do things like vitamin C products are also helpful in balancing out the color. And even finally, retin-A's and retinols also have a way of gently suppressing some of that as well. So if you are interested in different treatments, there are a number of them that are available. You just have to be thoughtful about what you do and just make sure that you might even consider pre-treatment if you're ever thinking of a skin treatment for patients who have skin of color.